How can I get rid of my eye bags? Can filler be done properly to achieve a look where the bags do not show, or do I need surgery to remove them? I notice them when I'm more tired or eat unhealthy. They get even worse, but they are always present. People often say I look tired even when I'm well rested.
Thank you for your question. Basically, you're asking the question as to how to address the under eye bags, and you've submitted some very good photos. And the decision point is whether or not filler would be of benefit, or does surgery be the more definitive solution. And you state at the end of your question that people are always asking you if you're tired no matter how much sleep you get. Well, that's very familiar to us in our practice. I'm a board-certified cosmetic surgeon specializing in oculofacial plastic surgery. That means my background training began with eye surgery, followed by specialty training for eyelid surgery. And in the world of cosmetic and reconstructive surgery, our specialty is the specialty that treats a lot of complex eyelid issues, as well as specializing in straightforward cosmetic issues of the eye area. When you are describing this situation, basically what you're describing is puffiness caused by something called lower eyelid fat prolapse. Lower eyelid fat prolapse means the fat packets that are around the eye push forward and create this bulge, and this bulge remains constant. Now, clearly you've done some research, so you've learned that many people are treating under eye bags with fillers. So how do we make this distinction as to when to use fillers and when not to? Well, in my practice, what we try to do is make the decision based on factors such as the degree of fat prolapse. In other words, after a certain point, the point of doing fillers is to create a softening of the transition between the valley that's created by the relative elevation or the bulge of the fat. And so if that bulge is too much, you can't put enough filler, and if you do, you're going to make the person look puffier. Another aspect to making this decision is, are you ready to go for regular injections of filler? And a lot of times people aren't, and they prefer to have a more definitive procedure. And then the other factors that have to do with whether or not you're a filler candidate also has to do with skin quality. With the limited photos you've shown, it's clear that you have light skin, that you're male, and that you're going to be you're somewhere anywhere between the ages 30 and 50. And so I would say that skin type may not improve well enough with fillers to justify avoiding the surgery. So again, because I have a lot of experience with this type of surgery, I'll share with you what we do in our practice. For someone like yourself, we would do something called a transconjunctival blepharoplasty. This means that what I'm doing is addressing the fat pockets from the inside of the eyelids. This way, this is something that men really appreciate, because what we're doing is we're avoiding an incision on the outside. Even when the incision is well healed, it's possible for that incision to be seen. And for men, since most men do not and cannot apply makeup, it's a preferred option to go from the inside. Naturally, there's concern about wrinkles and skin quality. So what we would routinely do to address that is at the same time do a combination of platelet-rich plasma, which is the material that we derive from your own blood, that has a concentration of the wound healing factors necessary when you have a cut. And what that does is it generates collagen, it generates blood supply, and improves the overall skin quality. And depending on the degree of wrinkling of the skin, we also use a technology called fractional CO2 laser. This is the use of a laser to remove a certain amount of skin and at the same time deliver a certain amount of heat into the backbone of the skin called the dermis, and that causes a tightening. And this way we avoid having to do surgery on the outside. This combination has been very effective and has been very successful in our practice, and I've been in practice for over 20 years. So from my perspective, and practically speaking, using the experience of men who've come to our practice, it's well established that more than about 50% of our patients for eyelid surgery are men. So there is a lot of men who share the same exact frustration you have. And so that combination approach and the procedure being performed under local anesthesia with light sedation, which means there's no general anesthesia, we're just doing kind of a liquid Valium equivalent in the vein so that you feel relaxed. The patients really appreciate the combination approach to address the puffiness, the skin quality, as well as the sedation, which results in a faster recovery and going back to normal life. In the modern world, nobody has time, so we get our patients back to work typically in less than a week. So I think that you should meet with qualified, experienced cosmetic surgeons who do a lot of eyelid surgery, who deal with a lot of men who have eyelid surgery. The reason I keep mentioning the gender is that there have been a lot of men who have had very poor results from eyelid surgery, whose eyes have gotten rounded, and if you just pick up any magazine in the supermarket, you'll see the, quote, plastic surgery disasters, and unfortunately a lot of males have suffered from undesirable outcomes. So as much as it seems very straightforward, the cosmetic eyelid surgery, especially the lower eyelids, can be deceptively complex. And other factors that I didn't mention earlier, such as the integrity of the tendon, the support systems, and all these other things are critically important to retaining a natural look. To basically look as if you didn't have surgery, there has to be a lot of work behind the scenes. So it's very important you choose the right doctor and you're comfortable with the approach. So I hope that was helpful. I wish you the best of luck. Thank you for your question.